one down the front here, please.
Hello, this is Gültekin. I would like to thank all the presenters for their presentations. And my question is to Karin. She mentioned about the Veterinary Institute and having a lot of analysis on the background, having a diverse people on the background, working a lot. So I wonder, how do you use that data to inform the public health policies? Like, how do you connect with the people from the human health side, and how do you inform these policies and like AMR and other things? How do you collaborate? Because I think it's really hard to collaborate with different entities. So I would like to hear your experiences.
Well, one of the things to keep in mind here is that sequencing data is in many ways a very new thing. And that is something we're seeing a lot in Norway. So Norway, the way things are organized, it's very sector-based. We have the public side, the human side, and then we have the veterinary side. And we're even under different ministerial departments. So that's how high up the divide goes. And one of the things is that any sort of, there is no legislation that really covers sequencing data. And this is especially challenging for the human side because the only rules and regulations they have basically say that they should take any data related to humans and lock it down in a drawer, basically. So they're currently working a lot to be able to be able to share something. But the way the system works now is that we share with them in very concrete outbreak-related cases. We don't have any formal sharing agreements yet, simply because this is so new. There is no regulation, there is no legislation. We're doing it because it works. But a lot of this is currently working on a trust basis. We're a tiny country. We're 5 million people. And half of us, most of the people in this field, know each other quite well. So we know who to call. If you have a salmonella outbreak, you know who to call on the other side. But this is, it works, but it's also slightly uncomfortable because we don't have formal systems to fall back on. And that is a challenge, and we're hoping very much that legislation both in the EU and nationally is going to help open up these things a little bit more so that we can get more of a routine way of sharing and collaboration going on this, so that we can help make sure that everybody's safe and happy, basically. Thank you.
Thanks, Karin. Any follow-up questions? Another one down the front.
Hi, and this is David Yuan from ENA. I have a question for Claire. I was just curious that whether, by the way, thanks for the good overview introduction of the OS tracker. I was just wondering that if there are any regulations or considerations at this point to generate revenue from the tracking system, so that you can feed back to the communities that are providing the samples, implementing care and share principle to a certain extent.
Yeah. So the data, I'm not sure if you mean something more specific by feeding back to the community, but the data that the jurisdictions put in is data they own, and they see the results of that analysis. But because they are the owners of the data, it's really up to them, I guess, what can go out beyond that to the community. In the other direction, one of our goals, one of the things we don't do yet, but would really like to, is to help people to chaperone their data into INSDC, where they've decided that that's appropriate. But did you mean something more specific by going back to the community?
I was meaning something more specific. Let's say that a research project goes to Aboriginal community, collecting the samples, and that kind of information can be really valuable or eventually generate some revenue for, let's say, make the medicine that.
Yeah. In this case, it's all public health management. So there is actually a research program hosted, which is the Ozpathogen program, that is research into public health. So I think it's really up to the data owners. It's not up to us to decide what can be done. Yeah.
Okay, thank you.
All right, thanks. And for the sake of time, we're going to move on to a different panel discussion now. But I'd like to thank all of our speakers again one more time.